Hi, I'm Dr. P.K. Talwar, board certified cosmetic surgeon from New Delhi, and I'm practicing cosmetic surgery for more than 30 years now. Previously, I was attached to Apollo and Max hospitals, and now I'm running my own cosmetic laser surgery center at Greater Kailash Part 1, New Delhi. We get a lot of patients who come for consultation. Sometimes we find that they are lost, they also don't know what questions to ask and how to discuss their problems with the doctors. So my first suggestion to all of you who are coming for consultation, to me or with anybody else, that you might write down your questions which are coming in your mind so that you don't miss any point when you are talking to your doctor, your surgeon. So if you write those questions, you will not miss anything, and when you leave the clinic, you will be totally satisfied that all your queries have been answered. Now, what are the things you should be asking your doctor? So naturally, the first thing is that when you discuss your problem, you should ask him whether whatever you are expecting, can he deliver it or not? Because we also are concerned that the patient which we take up for surgery should have realistic expectations. If your expectations are not realistic, then it is better for us also not to operate upon you, because it is not a good idea to have an unsatisfied patient and who is blaming you throughout his or her life that doctor has not delivered the goods and taken money. You end up spending money on that. The example is, suppose somebody comes to me and they say, we want the nose like Hrithik Roshan or Aishwarya Rai. So I tell them, no, it is not possible because the two faces are different, and then we also know that the expectations are not realistic. So we are not going to encourage such patients to undergo surgery, because my concern as an individual is not to earn money from you, but my concern is to help my patients who are coming to me and help them in a way the science can help them, because I can't promise something which I can't deliver, the science can't deliver, because then it's a futile exercise. So that is one thing, that you should have realistic expectation. Sometimes, everybody has got frustrations in life or some failures here, whether it's job, education, love affairs, or anything, and they blame it on their looks. And then they think that if they undergo cosmetic surgery, maybe they will get a better partner, or the girl they want, or the boy they want to marry, or they will progress faster in their profession, which may not be true also. So if you are blaming your looks for your failures in life, and we do cosmetic surgery, we improve your looks, still your frustrations may remain, because the cause of frustration may not be your looks only. There may be some other factors also which you have failed to notice. So that is another thing, that do not blame failures in life to your looks. At least I always tell my patient that even if I improve your looks, even I'll give you a more youthful look, a better nose or tighter face, still if you got any failures in life, or you think you're lacking something in life, that may remain. So that is another thing you must understand, that don't blame your looks for the failures, because that factor may remain. Suppose you improve, the only benefit will be that you will be a changed person. Your looks will improve, your confidence will improve, you will be more you can say outward going. You will understand that now you can face the world in a better way than what you had been. So all these things are there, so they are going to help you, help your confidence, help your even in profession, no doubt. But if you got any failures in life, so don't blame them on your looks. Now, other question you should ask your doctor is what kind of surgery he will be doing, how long has he been operating, what is his experience of doing cosmetic surgery, and are there any complications or not, and if there are any complications, so can they be dealt a better way, or whether he is competent enough to deal with those complications. Because I always tell my patients, every surgery has complication. 1 or 2% patients will have some complications or some undesirable results. Other doctors may or may not tell you this thing, but I am always honest to my patient. I tell them, yes, 2 out of 100 patients may get some infection, or they may not have a satisfactory results. So that you have to understand that it is something which is very scientific doctor is doing, but statistics also support our claim that yes, 2 or 3% patient may have some infection, some undesirable effects, and you should be ready for that, because once you trust your doctor, you know that he or she will be able to manage those complications, you are safe. So that is another thing you should ask. Then is where he will be operating, and then what are the cost of surgery. So that also will depend on surgeon's experience, how long has he been operating, how many cases has he done in so many years. So these are multiple factors. So all these things, if you write it down, take an appointment, discuss with your doctor, have realistic expectations, and understand that you are going to face the world in a better way, but don't blame your looks for your failures in life. And then naturally you have read everything on internet, you know the complications, you know the limitations, and then if you take up a decision, you take a call, and I'm very sure then you are going to be a very, very happy and very, very satisfied patient. So I hope I could convey to you what I wanted to convey. And if you got any other questions, any queries, any doubts which you want to clear, then you are most welcome to call my team, and they will be more than happy to answer any of your queries. So please do not hesitate, and you can call us anytime if you got any queries. And if you like the video, please do subscribe it. Thank you very much.